Mindfulness Cognitive Therapy and Buddhism by Venerable Rungruan Papasaro, Dr. Rungruan Lim Chu Patapa. The role of Buddhism in the cognitive science is very significant, as Francisco Varela, who is one of founders of the cognitive science, describes the Buddhism in terms of a cognitive process development as follows.
Buddhism is a practice, not a belief, and every Buddhist is, in some way, lay clergy, involved in the way a scientist is involved in his or her work, or in the way a writer's mind is involved in writing, present in the background, at all times. People today have the leisure and sophistication to practice what before was only practical for monks. Buddhism affects Western culture through the individuals who practice it, through people who occasionally take it up as an escape. Buddhist ideas are prevalent throughout our culture, in physics and biology, for example. The basic ideas are Buddhism in disguise. My view of the mind has been influenced by my interest in Buddhist thought. Buddhists are specialists in understanding this notion of a virtual self, or a selfless self, from the inside, as lived experience. The essence of the convergence of Buddhism and science that form Buddhism perspective, life is in fact a cognitive process. Buddhist ideas are prevalent throughout our culture, in physics and biology, for example. The basic ideas are Buddhism in disguise. My view of the mind has been influenced by my interest in Buddhist thought. Buddhists are specialists in understanding this notion of a virtual self, or a selfless self, from the inside, as lived experience.
In Buddhism, the technique of using mindfulness in cognitive process development is a proven success story, and it receives much attention by many Western scholars, especially in the field of cognitive therapy. Aaron Beck, who is regarded as the father of cognitive therapy, CT, and cognitive behavioral therapy, CBT, discovers that emotion, thought, and behavior are closely related to each other, and during the occurrences of negative emotions, then if we have a mindfulness observing on what is happening, then we can learn and make a correction on an individual behavior. The role of mindfulness in CBT demonstrates that the mindfulness can somehow cause a cognitive process to change an individual behavior in the way to respond to a receiving stimulus from the world. Later, in a discussion with the Holy Dalai Lama, they both concluded that in fact the Buddha is the first one who discovered this technique. This family of physiology therapies, such as mindfulness-based cognitive behavioral therapy, MCBT, acceptance and commitment therapy, ACT, dialectic behavior therapy, DBT, mindfulness-based stress reduction, MBSR, consists of three parts. Firstly, it starts with the cognitive therapy. The second part is the therapy for depression and anxiety reduction, and the third part is the addition of the role of mindfulness in the therapy. Thus, mixing both the mindfulness and the meditation into the therapy. As a matter of fact, all of these therapies apparently are somehow related to the ancient Buddhist practice of the use of mindfulness and cognitive process as clinical treatments to change negative emotional patterns of thinking and behaviors such as fear, anxiety, sadness, depression, etc. In dealing with troubling mind, a modern cognitive therapy and its derivatives, so-called the mindfulness-based cognitive therapy, is very popular in modern psychotherapy. The mindfulness-based cognitive therapy, MBCT, is a type of psychotherapy that is a modified form of cognitive therapy that incorporates mindfulness practices such as a combination of cognitive therapy, meditation, and the cultivation of a present-oriented, non-judgmental attitude called mindfulness meditation to teach people to consciously pay attention to their thoughts and feelings without placing any judgments upon them. By using these tools, clients will learn on how to break away from negative thought patterns that can cause a downward spiral into a depressed state, so they will be able to fight off depression before it takes hold. Mindfulness-based cognitive therapy, MBCT, was developed for people with recurring episodes of depression or unhappiness, to prevent relapse. It has been proven effective in patients with major depressive disorder who have experienced at least 3 episodes of depression. Mindfulness-based relapse prevention may also be helpful for treating generalized anxiety disorders and addictions. MBCT has also been shown to improve symptoms of depression in some people with physical health conditions. MBCT is group therapy, with once a week, 2-hour sessions, led by your therapist, as part of an 8-week program. You will learn meditation techniques as well as basic principles of cognition, such as the relationship between the way you think and how you feel. You will also have the opportunity to learn more about your depressive condition. On the days when there is no session, there is homework, which includes practicing breathing exercises and mindful meditation. There are a number of mindfulness techniques and exercises that are utilized as a part of MBCT. Some of these include meditation. People may practice guided or self-directed meditation that helps them gain a greater awareness of their body, thoughts, and breathing. Body scan exercise. This involves lying down and bringing awareness and attention to different areas of the body. People usually begin at their toes and move up through the body until they reach the top of the head. This part of exercise in Buddhism it is called having a mindfulness to be aware of the body, the posture of body, and the movement of body. Mindfulness practices. Mindfulness involves become more aware of the present moment. It's something that can be practiced during meditation, but people can also incorporate these activities into the things they do every day. This part of exercise in Buddhism it is called having a mindfulness meditation. Mindfulness stretching. This activity involves stretching mindfully to help bring awareness to both the body and mind. This part of exercise in Buddhism it is called having a mindfulness to make an extension from investigation on the body to the mind. In MBCT, rather than try to avoid or eliminate sadness or other negative emotions, one learns to change their relationship with these emotions by practicing meditation and other mindfulness exercises. These activities rebalance neural networks, allowing the client to move away from automatic negative responses toward an understanding that there are other ways to respond to situations. By developing a routine meditation practice, clients can use the technique whenever they start to feel overwhelmed by negative emotions. When sadness occurs and starts to bring up the usual negative associations that trigger relapse of depression, the client is equipped with tools that will help them replace negative thought patterns with positive. Apparently, the cognitive therapy and its derivatives are sorts of Buddhist practice modifications, and due to the lack of the completeness of the Buddhist practice as a system, several concerns arise in these therapies, such as what is the role of mindfulness in the mind development, how the mind can be incorporated in the mindfulness meditation, how the conative process can be executed without performing an insight observation, and how to perform an insight to gain wisdom. The Buddhist practice is not limited for only resolving the troubling mind of depression and anxiety, but it is applicable for resolving all kinds of unwholesome mind by the selection of proper dharma. In addition, the Buddhist practice establish a higher cognitive development by performing an insight observation to gain insight wisdom to deal with even any slight emotion within the mind processing. Therefore, a system of Buddhist practice should be investigated for a Buddhist mindfulness cognitive therapy, BMCT, development that we will discuss in next part.